Thank you, Sue. Really appreciate it. I am today honored to bring, I'm Shailja Dixit. I have been here on the show with Sue a couple of times. I'm CEO and founder of Curio Digital Therapeutics. I'm really delighted to bring two of our experts here on the show today, Dr. Grill and Dr. Domar. I'm going to give their introduction, but it's also very timely. This week, 23rd April to 29th April, is National Infertility Awareness Week. And we are so delighted to talk about this very important issue here and bring two experts here. So, again, let me before it's too late. Let me introduce my two guests. Dr. Ali Domar. She is a pioneer in the field of mind and body. Her research focuses on the relation between stress and various medical conditions. She received her MA and PhD in health and psychology from Albert Einstein College of Medicine. And she is at this point of time Chief Empathy Officer at Inception Clinic, as well as Associate Professor in OBGYN and Reproductive Biology at Harvard Medical School. Equally well known, Dr. Liz Grill is here with us. She's experienced as counseling psychologist and medical researcher with special focus on emotional aspect of infertility, IVF, cancer-related infertility, and sexual dysfunction. She's a clinical psychologist at the Center of Reproductive Medicine, Infertility, and is associate professor of psychology in the Department of OBGYN, Reproductive Medicine, Psychiatry at NY Presbyterian Hospital, Weill Cornell, at Cornell Medical. So, welcome and thank you so much for your time. I'm so delighted to be talking about this very important issue. So, let's get right in. I was just reading some statistics, with this week of awareness. 1 in 5 women are unable to get pregnant, and research estimates about 15% of the couple will have trouble conceiving. Wow, that's like I was surprised to read that stat. So I would love to actually hear a little bit from both of you experts here. Tell us a little bit about like what are you seeing in infertility from a trend wise, from the numbers that we talked about and the research that's going on in this area. So Ali, if I may turn to you
Yeah.
first.
So, in fact, the World Health Organization last or 2 weeks ago, we've always been saying literally for 25 years, it's 1 in 8, 1 in 8, 1 in 8 individuals or couples struggle with infertility. Now they're saying it's 1 in 6. So, if you yourself are struggling with infertility, you are not alone. And everybody watching this segment, I can guarantee you, knows somebody who is currently going through infertility.
I know. Um, Thank you for sharing that. And I'm sure, maybe Liz, if you want to talk about like what are the few factors that are like increasing these numbers and trends. Would love to hear a little bit from you about that.
Yeah, I don't know that we know necessarily. I mean, there's lifestyle issues and all sorts of theories about this, but I think from the mental health perspective, since we're both mental health professionals, what's most concerning to us is we know the distress levels from the research are high. Ali did groundbreaking research a while ago that shows that the distress levels are equal to those who have cancer and other terrible illnesses. So research has proven over and over again that these people are anxious, they're depressed, people going through infertility treatment are so stressed out, but not necessarily seeking the treatment that we know can help reduce those levels of distress. So I think our concern, and we can talk a little bit later about what we did to address that, is making sure that people know that they can get help. They don't have to suffer in silence and they don't have to suffer alone. There are places they can go for the relief and the coping strategies.
Um, so, totally agree with that. Ali, tell us a little bit. What do you think? I mean, I hear so many people have different kind of. I'm talking about patients or women. They have misconceptions about infertility. Tell us a little bit about what are the biggest misconceptions that you hear about fertility, infertility, and how does this create an impact or stigma?
I think probably the biggest misconception is that it's always the woman's fault. Everyone always assumes when a couple can't get pregnant, it's because there's something wrong with the woman. And, data out of Europe is just astonishing. We are now finding that almost half of all infertility is due to a male factor. And so it's pretty much equal. If a couple is going through infertility, it's just as likely to be a physical condition of the woman as it is to be a physical condition of the man, or a combination of both. Maybe both of them are subfertile.
So well said. Maybe we should start reporting these numbers in one in X couples, rather than saying one in X women, to take away that stigma. So that's so well said. Liz, tell us a little bit about like how does this create, a stigma? I mean, I hear so many women. I mean, and they talk about, oh my God, we have been trying, and maybe it's my fault, as Liz said, but it creates a huge amount of stigma. I have some friends who have gone through this process, and I've literally seen their personality transform. How they interact with their friends transform. Uh, Tell us a little bit what you have seen in your practice,
Yeah,
and throw some light on
I
that.
mean, it's devastating. People withdraw. They stop going to social functions. They stop going to baby namings, christenings, first birthday parties. They isolate. There's so much. It's shrouded in shame. And what's so sad is, like I mentioned, we know the distress levels are comparable to, say, cancer. But when someone has cancer, communities rally around them, right? They're like, who's going to bring them dinner? Who's going to sit with them in chemo? And you just don't see that with infertility. People kind of go into their homes and they isolate and they don't talk about it. And it's a shame, because we know that they need to come out of that isolation. And that's what National Infertility Awareness Week is really about, is, finding your voice and coming out from that isolation and finding the support that's there.
Uh, I, I, I can totally, and is there also a factor that it's such a long process that, how does that play into it? Because there are acute episodes, like, as a physician, which happen. There is uh, trauma around it, emotional aspect, and then possibly you start coping with it. It's such a long-standing journey.
But
I
it
mean, tell us
doesn't
a little bit more about that.
it doesn't need to be. I was part of a huge research study where we surveyed 2,000 people with infertility in 9 countries. And what we found was it took the average couple 3 years before seeing a doctor and then another year and a half before they started treatment. They tried on their own for up to 3 years. And with infertility, time is not your friend, especially in terms of the woman's age, although the man's age is also a factor. And so, what I say to anyone who's been trying for, depending on their age, 6 to 12 months, see an infertility specialist, because it doesn't have to take that long. Over the years, it used to be, 3 months of workup, and then 3 months of IUIs, and then 6 months of this. People are being fast tracked now to the most effective treatment. And so it doesn't, if you've been trying for 6 months in a year and you haven't gotten pregnant and you see an infertility specialist, you could be pregnant, pretty quickly.
So what I'm hearing both of you say is, yes, there is stigma, but you can actually take care of that, reduce that stigma and emotional aspect. Acknowledging, having your voice, as you said, Liz, and second is, don't wait. I mean, there is no need to wait and suffer. This is something that happens a lot these days, and go and seek help. It tell me a little bit more, Liz, coming to you, maybe. What do you see are the biggest gap? I mean, there is, science has evolved, right? There are so many assisted reproductive therapies out there, centers out there. Thankfully, there is employer coverage is also happening quite a lot in this area, but there still remains a gap. What do you see as the biggest gap in the fertility space today?
Well, I think what Ali said, definitely from the medical side, like people, that fear keeps people from reaching out sooner than they should. And, they turn sometimes to maybe celebrities having babies really later in life, rather than the science that shows that if you're aging, you may feel great, you may look great, but your ovaries are still aging, no matter how good you feel. So I think what Ali said is key. And then from the mental health perspective, reach out and get the help that you need. I mean, the reason Ali and I created we have the first digital app called Ferticom that we created in the space based on, medical research and science. And we created it because we knew that patients needed something in the moment that they were feeling distress, not a week later, not a month later, but in the actual moment that they're at work and they get their period and they don't know what to do, or they're at the Thanksgiving dinner table and their younger sister, who wasn't even trying to get pregnant, suddenly announces a pregnancy. And so we started to really fill that gap that you mentioned for mental health by giving something on a phone that someone could actually use in the very moment they're in crisis.
That's so beautifully said. I totally agree. I mean, and would love to hear a little bit more about the digital first approach, right? I mean, we Curio as a digital company, and we are so glad to partner with both of you and Ferticom. We believe that need to meet patient where they are or where their need is, and first can bridge that gap. It does not undermine the importance of seeing a therapist, but what it does is it brings you a tool when you need it the most, where you don't may not have any help. Ali, tell us a little bit more about Ferticom and the work. It has been in market for quite some time. So tell us a little bit about digital tools and how you have seen them filling the gap when patients come to your digital app and then possibly come to you. What's the reaction and how they use these digital tools?
Well, I think that, the average patient now, literally always has their phone within, inches away from them. And, I just saw that there are 702 mental health professionals in this country who have knowledge on how to counsel people going through infertility. There are millions of people in this country going through infertility. And although, Liz and I both see patients on a daily basis, as do the other 700 mental health professionals, we can't meet the demand. Liz and I came together at a Resolve event. It must have been 6 or 7 years ago, and it was Liz's idea. Let's create an app for those moments, because I remember we were first developing the app. We were having dinner with friends, and I showed the mock app to the friend. He goes, "Oh my God, it's like having you or Liz in my phone." So when you hit that crisis point, when you get your period or your doctor's office calls with negative test results, or you see one more birth announcement on social media, or you're at one more social event where someone announces a pregnancy, you pick up your phone and you look at Ferticom and you find that exact situation. And there are 6 things, scripts, how to deal with stupid people. There are, 10 different relaxations. There's everything you can do in that moment, as if Liz or I or any, psychologist trained in the field were sitting next to you and say, okay, take a deep breath. This is really hard. What can you do right now to help yourself feel better? And that's the goal of Verticom.
And I believe this app is available in the Google and App Store both, can be easily download, and all those who need help can access it. That's the beauty of it. You don't have to wait. You can just access the app and get to your answers and help that you're looking at any time, 24/7. Liz, tell us, and in the last few minutes here, what would be one piece of advice that you would give to our users, to find their voice, and very timely with this for Infertility Awareness Week?
That there's resources, there's your company, there's Ferticom, there's ASRM, the American Society for Reproductive Medicine, there's Resolve. I mean, people don't know how many resources are out there. So don't sit home feeling that shame and isolation. Just reach out. There's plenty of people that are there to help and who want to help. We see you. We know that you're in pain and we can help.
I think the thing I hear most commonly from patients is when, they talk to me or they look at the app or whatever, and they're like, oh, I thought I was the only one feeling that way. And, between Liz and I, we've had 60 years of experience seeing patients. And you are not the only one feeling that way. I mean, what Liz was describing is sort of almost being phobic about going to, birth announcements or gender reveals or whatever else. That's normal. Most people going through infertility have a really hard time when other people get pregnant. That's normal in our world. And people going through infertility need to understand that some of all their thoughts and feelings are normal, but there are lots of things out there which can actually help them feel better in that moment.
Oh, this is so nice. So I think one thing I would say is that we are very fortunate, Curio, to be working with both of you. I know we are bringing not just Ferticom, which has already been there. Also the next version of Ferticom, working with both of you, which is in making Fertility Lift for physicians. I think you both are pioneers in your thinking that think about a digital first approach. There is a lot of help, and having a digital forward pathway makes sure that there is access issues are taken care of, and not just US. This is something that is available internationally. So I know people who are even beyond US or North America can leverage something and hear your voice, and all of the research and wisdom that you both have collected over the course of year. So thank you so much for bringing these tools and for partnering with us at Curio. And again, as I said, the Ferticom app is available in App Store as well as Android. You all can download it. And then again, keep tuned to look at Curio and Ferticom for new updates that we are bringing in research and new apps.
Just it's also translated into French and Spanish for people
French
who are
and
not
Spanish.
English
Yep.
speaking.
Yep. So visit www.curiodigitaltx.com and ferticom.com, and download the app. I would encourage as many people to have a digital first approach to many of their situations that they are in and can help it. Thank you so much,
Thank you.
Alvira. Really
Thanks for
appreciate it.
inviting
Thanks
us.
for having us.
Yeah.
Take care.